Well, hello and good morning, everyone. We're going to get started here. This is Travis and I'm Olivier. We're from the Community-Based Research Center for Gay-Men's Health, and on behalf of our board of directors, our staff and volunteers, we would like to welcome you to the 2015 BC Gay-Men's Health Summit. Thank you to everyone that made it to a Stigma Bash yesterday and witnessed how intense Birch have conversation on the phone. So that was very interesting and illuminating to see, and CD Arts and everyone that was there. So thanks for everyone. Before we get started, with our program today, we would like to acknowledge that this event is taking place on the land of the Coast Salish people, the unceded land of the Coast Salish people. We would like to encourage you to reflect on this throughout our discussion over the next few days as we think about the stigma faced by gay and bisexual men in BC and elsewhere in Canada. We also have the opportunity to understand how this relates to other forms of oppression, including the lasting effect of colonialism on First Nation people. Our community includes many Aboriginal people, many of whom are here today, but many that are not present here today. And this is also something that we should reflect upon over this conference. And this year, we'll have a very great opportunity to reflect on the topic, as we're going to have a keynote presentation tomorrow on the impact of stigma on Indigenous health with Evan Adams from the First Nation Health Authority. So something to look forward to tomorrow.
Thanks, Olivier. So the summit would not be possible without financial contributions from our funders, some of which have supported the summit for many years. This is our 11th summit. So we in particular want to thank the Public Health Agency of Canada, the BC Ministry of Health, the Province of BC, the City of Vancouver Cultural Grant Program, and private community donations that have helped to make this event possible. And we want to recognize the participation of our community partner, the Health Initiative for Men, and our government partner, the BC Centre for Disease Control, who have really helped keep the summit going over the years. So thanks to both of those organizations and those of you who do good work with them. And finally, thanks to the presenters and all of you for coming. So we have guests from New York, I know, and Nova Scotia and Montreal. And
there's one from
Newfoundland. And Burnaby. Someone came all the way from Burnaby. Any places I've missed? Oh, Toronto. I've heard of it.
Edmonton, West End. Very, very far to walk. So usually this is the part of the program where we ask you to actually put your phone away, but we know all your phone are out already because you're all tweeting how beautiful we are. So we will ask actually everyone to take their phone out right now, because to the popular demand, we are bringing back the live poll of the BC Gay-Men's Health Summit because it was such a hit last year. So take your phone out, or you can steal your neighbor's. Make sure you don't look through the photos. You may find some stuff you don't like if you take your neighbor's photo, or things you may really like. So we want to get you excited about this year's program, so where you can go to this website and use the code there, and you can vote on their question. And we're kind of curious to see who has been to the summit before. So how many times have you attended the summit before? Are you a summit virgin? You've been here before, but you're still very new to the summit, or you've attended so many times that there's a permanent imprint of your butt in the seat you are on. So you can go and vote. I don't have my phone. Someone is looking through my photos. I think you need to show the winner by.
You can wait until they're all voted, otherwise they'll be. We're being very careful not to bias you, so you don't get to see what people have voted until, I know everyone's looking to see their little bar show up, but we know they're voting. So.
Okay. There's still people voting.
I know, I haven't even entered the code yet. I don't participate. Okay, I can't tell if they're still voting or if they're doing other things on their phones. Ooh,
We just
there's still some coming in.
give you the excuse to like get on Grindr right now, right?
Okay, well, sorry to those who haven't had a chance, but we're going to show the winner. Actually, I guess there's no winner. Everyone has their own answer. Summit Virgin? Wow, okay. So, welcome. Actually, it just occurred to me we probably wanted a tally of these, but that's okay. It's new technology, so Summit Virgins win. Welcome to first-time attendees, and I think you're all in for a really exciting couple of days. Don't you agree, Olivier?
Yes. This is our 11th BC Game and Health Summit. So I'm just. And I think I'm one of the few that have been to all 11th summit. I was 12 the first one, you can tell. And is there anyone else that have been to all 11th summit? Well, Terry and Rick, just Glenn over there. So there's quite a few of us. So this year theme is Undoing Stigma, and the programs include a wide range of topics of this very important theme.
So we have 3 plenaries this year. This morning we're joined by Mark Hatzenbuehler from Columbia University in New York City. Many of you will know that Mark has an impressive history of doing creative research on the effects of stigma on the health of LGBT people. And we're going to hear more about Mark shortly. And then tomorrow we have 2 plenary sessions. In the morning we have a panel addressing stigma in the lives of gay, bi, and queer trans men. And in the afternoon, as Olivier mentioned, Dr. Evan Adams will be talking about the health of Aboriginal Canadians and the intersecting experiences of stigma related to indigeneity and sexuality. And we are happy to report that this year all 3 plenaries will have simultaneous ASL translation. So we're also launching 3 new publications at the reception this evening. That's at 4:30 in the break room. So we hope you'll stick around for that event. We'll have a chance to review some of our collective writings.
Yeah. And this year, the summit is a bit special for CBRC. This is the official launch of a new initiative that we're doing called Resist Stigma, which you see the new logo on your name tag. Resist Stigma is a national initiative, and there's many people in the room that are already connected to this project, and we're waiting for you to get involved as well. Resist Stigma will be rolling out over the next year and a bit, and it's a project that will work with young gay and bisexual men across Canada and their health professionals to build better knowledge about stigma and to provide educational opportunities to learn more about stigma. And we'll also engage young gay men in a video production project where we'll issue a call across the country for young gay men to send us a proposal of a video they would like to produce that speak to the issue of stigma, and we'll fund up to 10 videos. So it's a very exciting new initiative for CBRC, and we just launched our social media. So if you still have your phone out and you're on Twitter and Facebook, find us, Resist Stigma, on Twitter and Facebook.
Okay, so now get your phones back out, and we're going to do one more question, although this time maybe I can show the answers. Oh no, that's what we do after we voted. Okay, so the question is, really on top of the technology this year. The question is, what are you most looking forward to at this year's summit? The keynotes, the reception and publication launch at 4:30 today, seeing who has the cutest outfit, making new friends, workshops, or meeting your future husband.
I can only get married once, so I'm sorry. Cannot be for everyone. Yeah, there is.
Okay, let's see. Are we ready? The winner is Keynote.
Keynote!
That's very...
Bunch of geeks. Actually, all of us that know Brooke Biggin know that he's going to come with the cutest outfit, so we don't need to kind of be here to know that. So,
okay, one more. Okay, this is a nod to qualitative researchers in the room. So you don't have to select an option from a list. You get to enter as text whatever you'd like. We don't have a character limit, but for the sake of time, let's try to keep it within a tweet. What would you like to see change in Canada as a result of this year's summit?
It's a word cloud, whatever. Well, if you don't have motion sickness yet, you can you can keep looking at this. So I saw more funding. I saw I saw a gay men strategy. I saw HIV stigma reduction. That's some of the stuff I've seen. Do you see anything else? Prep. So a lot of things to dream about over the next few days that hopefully we can accomplish over the next few years. So as this is still going on, I will introduce Dr. Terry Tressler to come and introduce the theme of the summit for us today.